Zach, thank you. Obesity continues to be a problem here in the U.S., and many report the only physical activity they get is at work, and even that is on the decline. So here to talk about all this is Dr. Michael Romain. He's an internist from the Austin Diagnostic Clinic. Good to see you, doctor. Thanks so much for being with us. Well, that's sad, isn't it? I mean, that's sad to report that any activity that we're actually getting is maybe walking to and from the break room. I mean, right? That's correct.
I think that, studies have shown that over the past 50 years that the amount of jobs that are available and people do these days as compared to 50 years ago are sedentary jobs. And they've tied that directly with the increase in the incidence of obesity.
So maybe 50 years ago we were seeing more manual physical labor, is that what you're saying? And now people are now behind on desk jobs.
1 out of every 2 Americans 50 years ago had a manual labor type job and were doing more things that were active. Now it's like 1 out of 5.
1 out of 5. And what are the rates? I mean, I'm reading some of the statistics here. They're saying 1 in 3 Americans is obese. And we should point out this isn't just fat or overweight. This is obese.
That is correct. This is obese. And you see different cities and different regions have a higher percentage than others. And as we talked about before, it's related to activity. A lot of it's related to activity. Some of it's diet. It can't all be tied to diet, but some of it's activity. In certain regions of the country, we just drive from one place to another. We don't walk anymore. And then the time constraint, people working more hours, and so they're tired when they get home, so they don't exercise, so they just basically get on this kind of treadmill where they, and I say treadmill, but it's not a literal treadmill, where they just basically go home, go to sleep, get up, and go back to work, and they sit at the same desk, and they do it over and over and over again.
And there was a report I was reading this morning that said something like sitting around is just as deadly as smoking, and I guess sitting around would then lead to obesity, which leads to all these complications, which can be fatal.
Oh, definitely. Obesity leads to diabetes mellitus. It leads to coronary artery disease. It leads to increased risk of stroke, increased morbidity and mortality. All those things that smoking leads to, obesity will lead to.
You have patients come in, they're obese. What do you tell them?
First of all, you have to take a self-inventory. You have to start, seeing what are you doing to combat this, and you have to be aware. Also, you have to point out the issue that they are obese. You look at you look at their weight, and you look at how their weight has changed over the past couple of years. Sometimes people don't really realize it and don't really know, and then you start talking about different strategies in terms of just starting off with just a regular exercise program, cutting down on the caloric intake somewhat, not doing something very drastic immediately because you don't want them to fail and just get disheartened initially.
Do you feel that a lot of your patients who maybe are obese are in denial? They're not aware of how big they are and what risk they pose to themselves?
Definitely. And most people are. With many illnesses, obesity is no different.
So what can we do? How do we combat it? I mean, what are some tips that maybe we can do at work or at home or just in our lifestyle?
Have a walking program. Start off with a walking program, something very, very light, 30 to 45 minutes a day, and gradually build up on that. Recognize that it is a problem, recognize the problems that it can cause. The problem is that, it starts at an early age, and when you're young, you're able to compensate for so many different things. Then you get to an older age and you can't. And so start combating it early.
I laugh about that because it seems like every 5 years our metabolism rate just
keeps on going down.
So we have to modify our lifestyle. Doctor, thank you so much. We appreciate it. Some good info this morning.
Thank you for having me.
All right. So